Hey everyone, it's Dr. Mike, founder of Performance Health and Chiropractic. Just wanted to take a brief minute here to share some new information that just came out with you. This information is so important, especially for those individuals that are taking acid reflux medications or medications for heartburn, and they are medications such as Nexium, Prilosec, or Prevacid. There was a clip that was just put out the other evening on NBC News, and it was about an article that was published in the Journal of the American Medical Association that was published on February the 15th, 2016, and it talks about these medications, or what are more commonly known as proton pump inhibitors, and their increased risk of dementia. Now, we already know that these medications contribute to kidney disease, malabsorption of vitamins and minerals, and also osteoporosis or weakening the bones, but now there's linkages with dementia. So take the 2 minutes, watch this video. I'm going to follow up on the other side to discuss it and give you some other tips that you could utilize to help with heartburn naturally.
Those new concerns about the prescription meds that so many people take to treat heartburn and acid reflux. 15 million Americans take them to block stomach acid, and as we reported last week, researchers suggest the medications may be linked to kidney disease and bone fractures. And now another concern being raised, that there may also be a link to dementia. NBC's Tom Costello has the information you should hear.
34-year-old Tara Hantman had acid reflux so bad it made her job as a speech therapist nearly impossible.
I actually got vocal fold ulcers and vocal fold nodules from it.
She found immediate relief in a very common medication to block the stomach acid, a so-called proton pump inhibitor. Among the most common brand names, Nexium, Prilosec, and Prevacid. But recent studies have linked the drugs to an increased risk of kidney damage and bone loss. And now, a large new study finds patients 75 and older who took the medication regularly had a significantly increased risk of dementia of 44%. Women taking the medication for at least 18 months were most at risk.
I mean, being 34 years old, even if dementia wouldn't hit me for another 40 or 50 years, it definitely concerns me that that could be part of my future.
The side effects may occur, say doctors, because we actually need stomach acid to digest our food, to ward off infection, and to absorb essential nutrients. Today, 2 of the drug makers told NBC News these medicines are generally safe and effective when used in accordance with the label and to avoid drug interactions. But many doctors are concerned that too many patients stay on the drugs too long.
If you have heartburn that is mild and it's possible to come off these drugs, then it's probably best to do so at this point.
Before today's study, Tara decided to stop taking all acid reflux medications. Instead, she's changed her diet. The result? No more acid reflux and no side effects from the meds. Tom Costello, NBC News, Washington.
All right, so what did you think of that short NBC News clip about the acid reflux medications? Pretty scary stuff if you ask me. Now, if you're taking these medications, I want you to stop and ask yourself a question. If you're taking them currently, how long do you plan on taking them? I bet you never really stopped and thought about that, but if you think about it, it's probably going to be for a lifetime unless you make the necessary changes. Now, what you're seeing in that clip, there's some scary stuff going on with these medications, and people never even stop to consider what the side effects are. We're talking about osteopenia or osteoporosis or a thinning of the bones. We're seeing increased numbers of that occurring, and we're seeing increased numbers of these medications. We're seeing problems with kidney disease. Now we're seeing increased risk of dementia, and that's a serious, serious problem. Now, these medications are no joke. I mean, they're amongst some of the most highly prescribed medications. In fact, Nexium is number 4 on the number of the top 10 list of most prescribed medications per month. Nexium, as I said, is number 4. It comes in at 15.2 million prescriptions per month. That's a huge number. If we look at the top 10 medications by sales, Nexium is number 7 on that list at 5.3 billion. That's billion with a B dollars spent on Nexium medications. Now, time and place for medications, but here's a news alert. You don't have acid reflux because you have a deficiency of these medications in your system. You have acid reflux because something has gone wrong. And that's what you need to figure out. What has gone wrong and how can you fix it? The answer is not in the medication. As we see, you take these medications, it's only going to lead to further problems down the road. It's just a matter of time before it starts to catch up with you. Now, Here's another news alert. You don't have acid reflux because you're producing too much acid. In fact, most time people have reflux because they're producing too little acid. Now you throw this medication on top of it, you're producing even less acid. So that's a problem. What happens is when you're not producing enough acid, your food in your stomach putrefies, it doesn't properly digest, and it, along with some of the acid, refluxes back up into your throat and causes that burning sensation. If you have enough acid and digestive capability, you're going to completely break down that food. It will tell the little band around the top of your stomach to close so nothing goes back up or refluxes back up into your throat, and then you won't have reflux. So you have to understand that it's not an absence of medication causing this problem. There's something has gone wrong. And as we shared with this, in this scenario, when you're taking these medications, you're not absorbing a lot of vital vitamins and nutrients, things like vitamin B12, calcium, vitamin C, iron, magnesium. And especially when it comes to B12, that's what they believe may be one of the linkages to causing some of this dementia. Calcium and magnesium and some of these other nutrients are contributing to the osteopenia or osteoporosis. So what you really need to do is take a look at your lifestyle. And lifestyle is one of the areas that you can make huge changes. Just like you saw this young lady in the video here, she made incredible changes to her diet and lifestyle, and therefore was able to come off of her medications, no longer had the reflux, and no longer had the unwanted side effects. Now, if you are taking this medication, you do need to have a conversation with your prescribing physician to see whether or not you can come off of them, but you also need to look at and consider your lifestyle and specific changes that you can make there. So let's go into a few of the things that you can do to help improve or reduce your risk of reflux naturally. So one of them, and one of the biggest, is that you can remove processed foods and eat more whole foods. So processed foods, we're talking about anything that has multiple ingredients in it and is not the same as what we call as a whole food. So pizza, crackers, cookies, cakes, pastas, all those are processed foods and they're garbage. When you put garbage in, you're going to get garbage out. So they're causing a lot of your reflux problems, especially when we look at items like wheat. We consume wheat day in and day out, most of us, and at multiple times during the day, which is causing a whole host of problems. So certainly a food group that you want to look at. You also got to look at alcohol and caffeine and sugary beverages. What you really want to focus in on is eating whole foods. And whole foods are items like lean meats, chicken, turkey, other poultry, wild game, beef. You want to look at eating lots and lots of veggies, fruits, nuts and seeds as they're tolerated, and good healthy fats like olive oil and coconut oil and avocado. They're going to provide vital vitamins and minerals and nutrients that are going to promote health and take you away from this whole reflux scenario there. Another thing that you can look at to experiment with is to add some acid into your system. And one thing that you can experiment with is if you take 1 tablespoon of apple cider vinegar, preferably organic, and you put it in a glass of about 6 to 8 ounces of water, and you drink that right before a meal. That will increase the level of acid in your system and help you digest food. Now, if you do this and you continue with reflux, or your reflux gets worse, then obviously discontinue it, and you should be working with somebody knowledgeable in this arena to assist. But if you find that you utilize this apple cider vinegar and you're having less reflux symptoms, there you go. We're putting acid into the system, we're breaking down your food, you're absorbing it, and it's not going back up into your throat. So you can experiment with that and see if it has an impact on your reflux symptoms. The last thing that you want to look at is supplementation. Now, supplements are just that. They should supplement a good, healthy diet first and foremost, but for some of us, we need that extra little boost to kind of get us over the edge until things heal up. So when we look at supplements, we could look at an acid supplement like a betaine HCl. That is an acid supplement that you could take right before a meal that will help you break down the foods and make them easily to digest. There are digestive enzymes that you could utilize like amylase and peptase and some of these other digestive enzymes that can help break down your food so it's not refluxing back up into your throat. And a nice side effect is that you're going to absorb a lot more of the vitamins, minerals, and nutrients. We can also look at things like probiotics. So important to digestive health, especially when we talk about if you have an infection with H. pylori. This will help crowd that out and help kind of battle that out and therefore get you the desired outcome of less reflux. And then you can also look at a gut repair program, which is a combination of an elimination diet, getting rid of the processed foods and focusing in on good whole foods, And then you can also use a gut repair formulation that's high in nutrients like glutamine, marshmallow root, things like that that are going to help nourish your bowels and your guts and help decrease the inflammation that's occurring that's causing a lot of the reflux symptomatology. So if you're taking these medications, be sure to have a conversation with your prescribing physician. I also encourage you to work with somebody who's knowledgeable in healthy lifestyles and diets and supplementation to help you get on the right course and right track there. But really take a look at the little slips that come in your medications that talk about the side effects. Again, so many people are just taking these and not even considering these side effects. And not only is it just this one medication, but you're often taking a number of medications as other things continue to break down, which only leads you to more chronic disease. So I hope you found value in this. If you have any questions or comments, please leave them in the section below here. Go ahead, head over to our website, www.performancehealthandchiro.com for more good information like this. Be sure to follow us on YouTube, and I look forward to continuing this conversation. Until we speak again, remember to eat well, move often, and stay healthy.